Hi, this is Joe Lowy. I'm the Director of Palliative Care, and I have the distinct pleasure and honor of speaking to two fellows. Paul is a fellow in geriatrics, and Raphael is a fellow in palliative care. They'll both introduce themselves. And this is for the purpose of a newsletter and for them to be able to express themselves because this unprecedented COVID crisis has changed everything. Even experienced palliative care and geriatric providers are having difficulty accommodating to this change, and it changes because there's so much of a greater need for both palliative care and geriatrics on the part of families and staff. The barrier of speaking to family members by phone rather than in person, the loss of our ability to see the communication that isn't verbal, to name but a few of the challenges we're dealing with. So, Paul, maybe you can introduce yourself first and
Sure.
say a couple of words about the impact this has had on you.
Hi, my name is Paul. I'm one of the geriatric fellows. Um, Currently, I'm being employed as like redeploying to one of the NYU COVID unit at LOH, orthopedic unit, which has been converted to essentially medicine unit. This unit is where we essentially have relatively stable COVID patients, but our job here has been to send these patients home safely back to the community. Um, as a geriatricians in training, I've been seeing, or we've been seeing a lot of patients with anxiety, worries, and some patients even with sorrows. Last week, we had to deal with two patients that one of their family loved ones actually like passed away, or somebody is in the hospital. It's been quite a difficult, challenging time. But so far, I'm glad to be part of, the whole fight against COVID. I will not be anywhere else. And I'm glad to be a part of it.
And I'm sure they're glad to have you as part of it. Raphael, maybe you can introduce yourself and say a couple of words about what you've experienced.
Sure. So my name is Raphael Bergman. I am a fellow in hospice and palliative medicine here at NYU. Currently, I'm deployed on a rotation at NYU, helping out with the inpatient palliative care team. The experience so far has been definitely different from the rest of the fellowship, or the first 9 months of fellowship so far. The service has been extremely busy. So I'm glad that I'm a part of it and being able to help out both with the COVID patients as well as the non-COVID patients. It's been very different from as far as our interactions with the patients and with their families than usual. Usually, we like to kind of build rapport with the patients and families, and spend time forming those connections and building a relationship. But unfortunately, that's not really possible. And a lot of the work has been done over phone, which does feel very impersonal. And I'd say that what seems to be very stressful to both the patients and families is obviously the limitations on visits. And, a lot of patients have been communicating with their families over, not telemedicine, either video phone calls or telephone or texting, any way to stay connected, because it's so isolating. I mean, already being in a hospital in this foreign environment and surrounded by people that they're not very familiar with is very isolating. And to not have visitations, and especially if they're COVID patients, to be in an isolated room where not many people want to worsen the exposure in the hospital. So it can be very isolating, and the patients and families really express that is one of the top things that's very emotionally stressful for them, dealing with this. So to be able to even communicate or help them, FaceTime or video call with their friends and families, and have any sort of connection seems to be, it's usually very valuable, but it seems to be extremely valuable in these circumstances. I'm glad to help out. I'm glad to even form these kind of what feels like very rushed relationships, where, besides, getting a sense of how the families or the patients are coping via their facial expressions or, these normal things with human interactions, we're going off of the change in their voice, or, even from 2 phone calls back to back on 2 separate days, you kind of get used to how a person's demeanor is and if they're going through something or sounding more stressed out. And sometimes it's helpful for patients and their families, and other times not so much, but we're trying to do what we can at this point.
Yeah, well, you said a lot of what's going on, certainly, and it is frustrating on the one hand for us that we can't do the hand-holding, the presence that we have in rooms or with families,
Mm-hmm.
and yet somehow we have to transmit that ability that we are trained to have over
Mm-hmm.
the phone, which is so limiting, but it's what we're left with. And I know the staff very much appreciates it. And I thank you both for the insight you have provided, and hopefully many people will be looking at this and getting a sense of what the 2 of you are providing and the service that you're helping to give that's so needed. All right. Well, thank you very much. And maybe we'll do this on a monthly basis.
We should, yes.
Okay. Bye-bye.